everyone. Thank you so much for joining me as we learn more about narrative therapy, and this is from Chapter 13 of our textbook, Postmodern Theories. Narrative therapy is a relatively new form of therapy that was introduced by two co-developers, Michael White and David Epstein. The main idea of narrative therapy is that individuals make meaning of life through how they interpret stories of events in their lives. Unfortunately, much of our interpretation of stories is influenced by the dominant culture, which often works counter to our own stories. White founded the Dulwich Center in Adelaide, Australia, and Epstein is the co-director of the Family Therapy Center in Auckland, New Zealand. In 1990, the two men co-authored a book, Narrative Means to Therapeutic Ends. Some of the global events of the 1980s included the Chernobyl disaster, the Iran-Contra affair, the spread of the AIDS epidemic, and, a little more positively, the development of pop culture. Interestingly, according to the History Channel's website, popular television shows like 30-something and movies like The Big Chill and Bright Lights, Big City depicted a generation of young men and women who were plagued with anxiety and self-doubt. They were successful, but they weren't sure they were happy. So that just goes to show that there was starting to be a shift in culture of more awareness of struggles like anxiety and depression. The idea of our lives being experienced in story form is not a novel or a limited concept. Many authors, such as Maya Angelou, recognize this concept too, which only makes sense. According to White and Epstein, as well as these authors, our lives are our stories, and we have the power to write and edit these stories. And I'll give you guys just a moment to read those two quotes. So we're going to pause here for a second to do a quick check of what we've learned so far. First question is, who were the founders of narrative therapy? Was it A, Freud and Adler, B, Ellis and Beck, C, White and Epstein, or D, Skinner and Bandura? And of course, the answer for this first one is C, White and Epstein. Second question is, when was narrative therapy born? Was it A, the 1890s, B, the 1980s, C, the 1950s, or D, the 2000s? And if you remember correctly, the answer is B, the 1980s, and it was born in Australia. Narrative therapy was born out of other postmodern theories, and especially social constructionism. And in social constructionism, social constructionists value the client's reality without disputing whether it is accurate or rational. And they follow the idea that our knowledge about reality is socially constructed, based on language and the current situation. So this would be really important knowledge for working with diverse clients because their cultures would be different, and so their construction of those cultures would be different. In narrative therapy, individuals construct meaning of life and interpretive stories that then become their truth. So this is combated the majority of the time when the dominant culture narratives win out as normal over our individual truths. And that's really at the crux of the problem with patients looking for narrative therapy, is that their stories have been constructed by culture and not by themselves. So their interpretation is a little off-center because of that. Narrative therapy shifts from most traditional theories, and then it places so much agency in the client. The primary role of the counselor is simply to listen and to ask questions. In narrative therapy, counselors are encouraged to establish a collaborative approach, listening respectfully to the client's stories. They are expected to search for times in the client's lives when they were resourceful. This shows that the client can be competent and successful. They use questions to engage clients and facilitate their exploration. Counselors avoid diagnosing or labeling clients based on one problem. They assist clients in mapping the influence of a problem in their life. And they assist clients in separating from the dominant stories so they have room for their own alternative stories. Here is a breakdown of the basic principles of narrative therapy. I'll explain these more fully as we go through the next few slides, but this graphic provides a great overview and introduction to the concepts of narrative therapy. So starting at the top and moving clockwise, we have that the therapist is influential but de-centered. Again, the focus is on the client as the expert. The person is separate from the problem. All problems have exceptions. The opposite of the problem is preferred. Then the preferred story is woven into a new identity. The impact of relationships are explored. Counselors help clients deconstruct societal norms. Personal decision-making is supported. And again, it's circular. Narrative therapy is all relational, and it all has to do with the deconstruction of clients' concepts of what has influenced their stories, and then the counselor helping the client to re-author their stories. Again, the focus of narrative therapy is the idea of how our lives are lived by the stories we tell about ourselves, and unfortunately, by the stories that others tell about us. These stories shape our reality and are strongly influenced by our social and cultural context. Whether accurate or not, these stories become our lived truths. In counseling, counselors withhold judgment about stories and view clients as courageous victors who have vivid stories to recount. These stories certainly change the client, but they also can change the counselor, who views himself or herself as privileged to be a part of the client's re-authoring of their story. In narrative therapy, the most important tasks for the counselor are to listen and to question. As counselors listen, they should have an open mind. Counselors should affirm and value the client's stories, and then they should take it a step further and deconstruct normalizing judgment. This is judgment that places people on a normal curve, so looking for what might make a client normal. The goal for counselors is just to avoid all judgment and to see the clients as individuals. They do help clients judge the judgments made about them, and again, help clients deconstruct the stories that have been built and constructed by others and by culture. Counselors avoid totalizing language, so they separate the person from the problem. Clients are not one-dimensional or broken records, so counselors are not getting caught up on one problem that a client keeps coming back to in his or her story. And one really important concept of narrative therapy is that clients are the primary interpreters of their own experiences. So like with some other therapies that we studied earlier this semester, the client is the expert, not the counselor. So in very simple terms, hurt is caused by a client's inaccurate or incomplete understanding of the key stories or experience of their lives. And this hurt can be due to influence by society or culture, and that's what shapes the client's truth. Change comes from analyzing these stories and joining with others, like the counselor, to form a counter story or an alternative story. We're going to pause here again for another quick check. And the question now is, what main idea of postmodernism was narrative therapy born out of? And there's a hint in the bottom right corner. Was it A, social constructionism, B, feminist therapy, C, psychotherapy, or D, solution-focused brief therapy? And of course, the answer here is A, social constructionism. There are 8 steps of the narrative therapeutic process, and I've summarized them here on the slide, but I'll share them with you fully here in the audio recording. So the first step is to collaborate with the client to come up with a mutually acceptable name for the problem. Second step is personify the problem and attribute oppressive intentions and tactics to it. So this is that idea of separating the client from the problem. The person is not the problem. The problem is the problem. Step 3 is investigate how the problem has been disrupting, dominating, or discouraging to the client. 4, invite the client to see his or her story from a different perspective by offering alternative meanings for events. 5, discover moments when the client wasn't dominated or discouraged by the problem by searching for exceptions to the problem. And this is another important step, as it shows the client that they are competent to solve their problems, that the problem is separate from themselves, that they are not always their problem. The next step is to find historical evidence to bolster a new view of the client as competent enough to have stood up to, defeated, or escaped from the dominance or oppression of the problem. So at this phase, the person's identity and life story begin to be rewritten. Step 7, ask the client to speculate about what kind of future could be expected from the strong, competent person who is emerging. As the client becomes free of problem-saturated stories of the past, he or she can envision and plan for a less problematic future. And then the final step, step 8, is to find or create an audience for perceiving and supporting the new story. It is not enough to recite a new story. The client needs to live the new story outside of therapy. Because the person's problem initially developed in a social context, it is essential to involve the social environment in supporting the new life story that has emerged in the conversations with the therapist. Like Carl Rogers, White and Epstein believed more in the power of the counselor's way of being rather than on certain techniques. However, some structure comes from a series of maps or narrative conversational trajectories which provide directions for questions in conversation. The first step in the process is to ask questions. The purpose of questioning is to generate experience instead of to gather information. The aim is to progressively discover or construct the client's experience. Counselors should ask questions from a not knowing position. They should not ask questions they already know the answer to. This provides the clients with a chance to discover themselves. The 3 steps of questioning help the counselor learn how the problems first became evidence and how they have affected the client's views of themselves. Finally, the counselor and the client work together to create a new interpretation of the story. Through questioning, the client can begin to see that they are not the problem. The problem is the problem. Our problems are products of the cultural world. Once a client can see the problem is separate from themselves, they can analyze it more objectively and form a relationship with the problem instead of it just being a part of them. This facilitates hope and lets the client take a stand against a specific storyline, like self-blame. So instead of saying, "I'm an alcoholic," and owning that as a part of themselves, they can say, "Alcohol, which is separate, has invaded my life." The next move in the map of the narrative conversation is helping the client identify new outcomes for their stories. In this step, counselors ask questions to help the client envision what their preferred identity stories or solution stories are. So they do this by highlighting moments when the problem didn't occur or was dealt with successfully. They show the client that they are not the problem. The final 2 steps on the map are creating alternative stories and documenting the evidence for these new stories. A turning point in the narrative interview comes when clients make the choice of whether to continue to live by a problem-saturated story or to create an alternative story, which is the hope. The counselor, through questioning or free-flowing conversation, helps the client create a more coherent and comprehensive story. This leads to the ultimate hope. Today is the first day of the rest of your life. The final step on the map is documenting the evidence. Narrative practitioners believe that the only way for a new story to take hold is if there is an audience to appreciate and support them. This helps the client move from the therapy session into the world. One technique is therapeutic letter writing. This is done by the therapist, not written by the client, and is essentially a synopsis of the session, pointing out the growth and change within the client. In this way, the client can read the letters repeatedly and be re-inspired. by seeing where they started, how they separated themselves from the problem, and how they created an alternative story and are now living that alternative story. And here's our final quick check of the presentation. First question, in narrative therapy, who is the expert? Is it A, the counselor, B, society, C, the dominant culture, or D, the client? And according to this type of therapy, the answer is the client. The client is the author of their lives, but the counselor comes alongside them to help them deconstruct and then recreate their own story. Sometimes these stories can be influenced by society and the dominant culture, but it's always the client who is the expert. Second question, what is the final stop on the map of narrative therapy? Is it A, questioning, B, externalization, C, reauthoring, or D, documenting the evidence? And the question here again is D, documenting the evidence. This is the final step because it's when the client's story is brought in front of an audience who helps kind of bolster the new ideas and bolster the new reality for the client. Thank you so much for joining me and learning more about narrative therapy. As we move on from this theory, I want you to consider this question. What is your story? Or more accurately, what are your stories? And how might they have been influenced by culture to give you an inaccurate reality? Going forward, how can you reclaim and reauthor your truth? Remember, today is the first day of the rest of your life.